Hi, my name is Shivani Sharma, and I am a PharmD candidate of 2021, and I will be talking about a medication called Nifedipine. I will go over patient counseling, mechanism of action, dosing and administration, warnings and precautions that we want to watch out for, and some monitoring parameters. So Nifedipine is mainly used to treat high blood pressure, but can also be used for chest pain. It can be taken with or without food. It does not matter what time of day you take this medication, but try to take it at the same time every day. If you miss a dose of this medication, take it as soon as possible. However, if it is almost time for your next dose, skip the missed dose and do not double the doses. Store this medication at room temperature away from light or moisture. Some side effects of this medication include flushing of the skin, swelling of the hands or feet, lightheadedness, and dizziness. Tell your doctor right away if you experience any rash, itching or swelling, chest tightness, abnormal heartbeat, or new or worsening chest pain. So what is Nifedipine? Like mentioned earlier, it is a medication to treat high blood pressure, but also used for angina. It belongs to a group of medications called dihydropyridine or DHP calcium channel blockers. Some brand names that are used in the market are Precautions, Adalat, and Nifedipine. It is also pregnancy category C. There are two ways Nifedipine works. It reduces blood pressure and on a lesser scale helps with angina. When taking Nifedipine, it's highly specific to vascular smooth muscle found in the body. It inhibits the calcium channel found on the smooth muscle, which decreases the intracellular concentration of calcium. This leads to a smooth muscle cell relaxation, which causes vasodilation. This ultimately reduces blood pressure. Nifedipine can also dilate coronary arteries. When coronary arteries are blocked, they are obstructed by atherosclerotic plaque that can cause chest pain, but since Nifedipine causes vasodilation, they help restore the blood flow. Dosing and administration. For hypertension, the initial dose of Nifedipine is 30 to 60 milligrams by mouth daily, with a max dose of 90 milligrams a day. Precautions has a max dose of 120 milligrams a day. For angina, the initial dose is 10 milligrams by mouth 3 times a day, with 180 milligrams a day as a max dose. But doses greater than 120 milligrams are rarely needed. For hepatic impairment, no specific guidelines, but we want to monitor blood pressure and adjust dose as needed. And for renal impairment, there is no dose adjustment needed. Some side effects of Nifedipine include cardiovascular, gastrointestinal, neurologic, and dermatological side effects. For cardiovascular, it may cause hypotension and peripheral edema. For gastrointestinal, it may cause some nausea and GI obstruction or a GI ulcer, which is very rare. For neurologic, it can cause dizziness, and for dermatologic, it can cause flushing. Warnings and precautions. Some contraindications to Nifedipine are people who have cardiogenic shock or dihydropyridine hypersensitivity. We also want to be aware that Nifedipine is a CYP3A4 substrate. That means CYP3A4 inhibitors or inducers can change the concentration of this medication. We also want to avoid grapefruit juice when taking this medication. Concomitant use of clopidogrel may result in decreased antiplatelet effect and increased risk of thrombotic events. Some things healthcare professionals should monitor in patients taking Nifedipine includes blood pressure, heart rate, angina, signs and symptoms of peripheral edema, and liver functions periodically. These are my references, and thank you for listening to my presentation.